Good evening, everyone. Greetings and a very warm welcome to our monthly webinar brought to you by the Institute of Public Health, the College of Medicine and Health Sciences at UAE University. I am Yasser Al-Hadi, PhD student at the Epidemiology and Biostatistical Consulting Unit of the Public Health Institute, and it's truly my pleasure to serve as your moderator for today's session. The Institute of Public Health is deeply committed to providing a platform for knowledge exchange, professional networking, and continuous learning through these interactive webinars. So this season series forms part of the global initiative, This is Public Health, which aims to highlight pressing public health priorities worldwide. We are also honored to collaborate with ASPHER, the Association of Schools of Public Health in the European region, as part of our shared commitment to advancing public health education and practice. So before we proceed, just a few quick reminders. Please feel free to engage and ask questions throughout the session, and we will try to cover all questions by the end of the session. Please use the Q&A option at the bottom center of your Zoom screen to write down your questions. This webinar is being recorded and will be available afterward on our YouTube channel, Institute of Public Health, CMHS. You will also find past webinars there. I'm also pleased to share that this session is credited by UAE University for 1 credit CME credit hours. After the webinar, you will find an evaluation link in the chat. Please, your feedback is extremely valuable, and once you complete the evaluation, you will receive your CME certificate of participation. Now, it's with great pleasure that I introduce today's distinguished speaker, Mr. Ross O'Brien. Mr. Ross O'Brien is a digital health consultant and growth advisor with extensive experience in scaling companies in the AI and immersive healthcare sectors across the United Kingdom. He has supported hundreds of organizations in navigating sales and procurement, regulation and compliance, market analysis and segmentations, and various processes including the investment and fundraising. Ross is a co-founder of the UK XRHA Health Alliance and co-authored the landmark report, The Growing Value of the XR in Healthcare in the UK. This report united the NHS, UK Research and Innovation, and Health Education England in forming a national strategy for immersive healthcare. Through XR Health Alliance, Ross continues to support hundreds of XR health companies via the Mindset XR program. Previously, Ross served as Managing Director for Wysa, UK and Europe, the world leader in AI-based mental health support, reaching over 6 million users across 95 countries. He successfully positioned Wysa as a leading provider within the NHS and secured contracts for both children and young people services in and adults programs. Before that, Ross has held several senior leadership roles within the NHS, most recently as a Director of Innovation and Technology at Central and North West London NHS, where he also led the Grenfell Health and Wellbeing Service, the NHS mental health program established following the Grenfell Tower tragedy in 2017. He also served as a program lead for the London Digital Talking Therapies program at Health London Partnerships, where he oversaw the creation of a digital single point of access and triage tool for all those seeking NHS talking therapy services in London. Ross is a graduate of the Digital Health London Pioneer Fellowship and a current fellow of the NHS National Innovation Accelerator. He holds a master's degree in human rights from the University in London, and he lives in Hove in the UK. The title of his presentation today is Responsible AI and its Impact on Public Health. Ross, the virtual floor is yours, please.
Thank you very much for that warm introduction, Dr. Yasir. I really, really appreciate it. And it helps me with my first slide because I was going to explain who I am. But instead, what I will do is explain why I'm here today to talk to you about a subject which I believe is very, very important for the future of public health generally, and the future of innovation, and that is responsible AI in public health. I'm hopefully today going to talk to you about some of the work that's happening globally, and how it can influence and impact your work, and what's happening in public health in UAE. But just to add to that very warm welcome that I've received today, and kind of more, why am I here? Why am I talking to you about this subject? So for me, my career has very much been about health delivery in the UK's NHS. I've been both a commissioner and provider of services here. What I have seen over the years is a move towards digital at quite a fast pace. What I now see is a move towards AI at the most alarming pace, with both positives in terms of our move and applications of AI, but also negative. And today, hopefully, I'll be able to imbue in the audience an understanding of what is responsible AI and why we should be thinking about it in all aspects of public health. So let's start with framing the issue here. Why is AI usage surging in public health? Why is it important to us? Well, we know from evidence and global studies that healthcare costs are rising globally. We know that the average is about 5% globally year on year in terms of rise in healthcare costs, and we know that UAE and the Middle East is slightly ahead of that at around 6.5%. So it's really important that AI can help us to negate some of those rising costs. And AI is already being seen used in the application of the chronic disease burden. So looking at how it can be used in diabetes, how it's being used for CVD, and how it's being used in obesity services. It's very much already there and being used at scale. There's a need for efficiency, and there's a need for trust between patients and clinicians. And the surge that we've seen in AI usage is very much often around that operational efficiency, so kind of back office processes, but also as that's happening, there's an opportunity with AI to also build trust, where you can show at scale how it's robustly being used. And UAE has very much led the way globally in terms of establishing strategies so that AI can be implemented across health systems at pace. So looking at the UAE Vision 2071, a visionary long-term program, looking at the AI Strategy 2031, and looking at what the EHS or the Emirates Health Services are doing digitally in terms of their transformation initiative. So lots of scope for AI already being used in public health. To dive a little bit deeper, let's have a look at some of the public health specific applications. So we've all lived through it. There's no need to labour what COVID was or the impact it's had on society. But what we learnt from COVID for a global pandemic was that AI has the power to help us predict epidemics, how they spread be able to monitor how we can tackle epidemic spreads, and also to be able to use them as surveillance mechanisms. So we have real-time public health data at such a grand scale due to the power of AI being able to support to make sense of all of that data in real time. There's also the opportunity to support public health initiatives through advanced diagnostics, and I think we see this already in cancer detection and the detection of respiratory conditions. And the gains we see in medical imaging, improving patient outcomes, are very, very much real. They're very much influencing everyday practice, scaling and becoming the norm in terms of the prevention and kind of mass population health support. And one common initiative that's now gaining traction across global health systems is the move from hospital to home. And AI is already enabling that, providing us the ability to monitor patients on a patient-by-patient level, but across entire health systems with smart devices that are AI-backed, and management of data that is AI supported. We also now have the ability to provide personalized wellbeing support tools via AI chatbots. So my background very much working in the behavioral health sector, we've been able to scale AI chatbots to millions of people in my previous role as managing director for Wysa UK and Europe. But the application of AI for preventative public health measures is absolutely fantastic, and many of us will already know how it's being used across health to give personalized, stigma-free, confidential, direct help and support, both for a range of psychological well-being, behavioral health needs, but also physical health, like rehabilitation programs and monitoring programs too. We see fantastic usage of AI across population health analytics, in genomics and personalized preventative programs to improve population level health outcomes. But we also have the ability to automate risk stratification, so making it easier to look at high risk groups, to identify chronic diseases, and to be able to monitor those in real time with wearables like a smartwatch or a phone that can help detect things like hypertension or heart disease as well. So that's very much just a high level flavor of some of the applications we see in public health. So if it's also rosy, and if it's also fantastic, and if AI is the answer to all of our public health needs, why am I here talking about responsible AI? I think this much cited internal communique from within IBM back in 1979 really kind of speaks to what we're talking about here. So back in the late 70s, this was a company-wide communique that simply said a computer can never be held accountable, therefore a computer must never make a management decision. Now, I think if we think about everyday life and AI decision making, I think most of us in this room can think of a real life example of where AI is making decisions for us and making kind of executive decisions in our life. If you think of, say, for example, taking a journey from A to B in your car, turning on the maps navigation, saying where you want to go, and then letting AI basically make the decision for you about which route to take, and what's the best way to get there. So I think as we let AI make more of those decisions for us, we also then become susceptible to some of the bad decisions AI can make, like routing us through roads that appear on a map but might not have been built or finished, or routing us through new roads which might have a one-way system in place, so that actually takes us the wrong way up a road. Or us as humans knowing actually there might be a back route somewhere which is actually faster to get from point A to point B. So I think learning that AI will kind of give us decisions and make decisions for us, but also knowing that sometimes we still have power and agency to make better decisions than AI in its current form is really, really important. And I'm going to go into detail in the next slides in terms of how we might think about embedding responsible AI. But I think it's also worth noting that Her Excellency Mubaraka Ibrahim, who's the Emirati Health Service Chief Artificial Intelligence Officer, is leading the way in recognising the importance of this statement and how ultimately perhaps handing over all of the power of decision making to computers or to AI might not be the best way forward. So let's dive into it. What is responsible AI? So at a high level, responsible AI is about ensuring AI safety and that systems are safe, transparent, and reliably deployable. At its core, responsible AI mandates a continuous process of inquiry into the AI's impact, its fairness, and governance throughout its life cycle. Responsible AI advocates for human-in-the-loop integration, so not just letting the AI do its thing and blindly accepting the results of that, and ensuring that the AI is built and it's monitored constantly in order to ensure there's ethical conduct and practical validation of the tool always. One of the central tenets of responsible AI is also around defining acceptable error levels. AI, like any system, cannot be perfect. So what is the tolerance for error? What should we accept and proactively establish as a kind of a performance KPI for AI in order that we can deploy it, but understand that occasionally, sometimes it will make mistakes. And what does responsible AI look like? Robust governance and compliance frameworks are really, really important to underpin responsible AI out in the wild. So adherence to PDPL, adherence to ISO standards, adherence to standards like BS 30440, and the NIST risk management framework are all really, really important governance and compliance frameworks that we should know. But I think away from like compliance and standardization, responsible AI should look and feel and act transparently and allow for audit of the system. So systems must provide clear decision-making processes, enabling clinicians to be able to understand and validate the recommendations that AI is making for patients and the health and well-being of those patients. Responsible AI is also about equality and cultural and linguistic inclusivity. This is a really, really important one, and this is where, for public health globally, UAE can really, really lead the way, because UAE's diverse population lends itself to very deep cultural and linguistic inclusivity in terms of the population and the demographics. So it's really, really important that the data isn't trained, or the solutions aren't made for one culture or one language set. And I think public health in UAE very much offers the opportunity to do something fantastic for global initiatives in terms of public health. And responsible AI also looks like something that is constantly monitored. It's not monitored once a year. It's monitored all of the time, 24/7, in terms of its safety, in terms of its efficacy, in terms of its alignment with healthcare objectives. And interestingly, this might be quite a new concept for many, but actually responsible AI has been around for 12 years. The principles of responsible AI have been built on over that period, and there are many lessons that we can learn from its the development and deployment of the initiative. One of the learnings has been over time, as we've moved from kind of a much more simple and basic artificial intelligence through time to now, the giant leap we're seeing with large language models and Gen AI is that inevitably AI will get it wrong. Regardless of how sophisticated the models are and the fail-safes we put in place, AI will simply give you the wrong answer. And I think I'm sure many of the people here today in the room will have used some of the newer large language models for their own studies or reflections, or looking at areas in your life and your knowledge base which you yourself hold a lot of knowledge and understanding of, inputting that into the ChatGPTs or the Claudes or the Geminis or the Perplexities of this world. Other language models do exist, and getting a result which you know instantly is incorrect or patently untrue, and then responding to the large language model, talking about that, and getting a result where the Gen AI or the large language model comes back and says, actually, you're right. I've completely and utterly got that wrong, and I'll go and review that now. Sometimes, or more often than not, unfortunately, carrying on getting it wrong. So I think we can see already that that it's not perfect, and we should build in for the inevitable failure of the models. And I think there's also something around this focus of responsible AI is not on just preventing the errors, but on proactively preparing for those system failures, knowing what's going to be coming down the line in terms of what's wrong, and having fail safes in place for critical public health infrastructure and applications. So some of the so this poses a question in terms of safety. Large language models do have, and Gen AI does have challenges. We can see that some of these challenges in where they're applied in high risk critical care environments just aren't going to be good enough. It's going to be an issue, and the LLM isn't going to be deployable in all public health scenarios where human lives are at stake. Also, where AI's decision-making process aren't clearly explainable, but bluntly, it's going to end up in court. So thinking really, really clearly and using the pragmatic application of responsible AI principles will lead you to a place where those legal liabilities are diminished, decreased, or de-risked. But I think it's a really interesting concept today to talk about black box soup. So soup, as you know, is a mixture of different ingredients. And if we look at the definition of what is this black box soup, software of unknown provenance refers to, or soup refers to any software, including AI models, where you can't fully trace, verify, or guarantee how it was developed or how it behaves. Now, why is that important to us? So in regulated sectors like healthcare, using soup or software of unknown provenance is risky, because if you can't explain or prove how the system is making the decisions, you can't defend its safety. And what's the worst thing to do in health care provision and public health safety is to make things up from a non-evidence based position. So large language models are effectively treated as soup because their internal workings are opaque, or they're a black box. Their training data provenance is often unclear, and they can't be guaranteed to be safe in high stakes environments. So this is really, really important to us. But actually, if you turn this on its head, it can actually also be a benefit. So the limits of large language models can also help us. Hear me out here. So the challenges that we see with large language models in terms of being able to manage that complexity or ambiguity means that human expertise remains crucial for the critical analysis and contextual understanding of what the large language model is doing. So, put simply, humans need to remain in the loop. Humans need to have the ultimate decision-making authority, and that needs to stay with healthcare professionals and preserves human agency in healthcare. I think I often liken this at this point to, don't worry, AI is not going to take all of our jobs. It's really, really important that as AI develops, using a responsible AI framework, we bake in this human in the loop necessity now, so in the future that also remains, and we remain kind of in control. And it also means that in high risk public health applications, there is a safety buffer. We're preventing autonomous AI action, and we remain in control with our oversight and validation. So if I was to bring that all into one space, into one kind of model, what are the core pillars of responsible AI? What have we talked about so far today? Traceability is really, really important. Recording where the data came from, recording the model versions that have been deployed, and being able to understand the makeup of the AI tool or software. Having various layers of safety and designing in from the start for error tolerance, understanding that there are going to be errors and ensuring that there are mechanisms to make us aware of those errors so that we can deploy AI in a safe manner. Transparency has been really, really important. Non-black box soup models where we're able to explain the decisions that the AI is making, where, why, how it's following an evidence base, and how it's following guidance from registered, recognised healthcare bodies. And accountability, ensuring that national bodies like the UAE's Ministry of Health Data Governance team are assigned responsibility for the maintenance and compliance of tools used in public health across the region. And what are those enabling factors that we need for responsible AI to actually happen and to be able to be scaled across the landscape? Well, first and foremost, this is such a massive change. There is a need for education, there is a need for support, there is a need for practical guidance, there is a need for validation of the workforce to ensure that they are ready for AI, to ensure that where they are not ready for AI, everyone is brought up to a level of skill and understanding where they're able to advise patients on the impact of AI in everyday healthcare. We need stakeholder collaboration, so we need partnerships between clinicians and health workers, policymakers and technology providers, so that the design and influence of what gets out there for patients is something that's been created with that kind of triangle of safety between the clinical community, the policymakers and the technology providers, but obviously also having the patient at the centre of that triangle. We need continuous monitoring. An annual check or an annual audit is not going to be enough. So what do I mean by that? We need to move to the near future, which is automated compliance for public health AI. We need annual audits to turn into automated audits. So rather than 364 days of the year, AI tools being out there and being used and not checked up, and then one day a year kind of having a look and see if they're safe, automating the 24/7 everyday audit of those tools, providing a way that they are continuously self-monitoring, making sure that they continuously adhere to regulation, continuously operate in a safe way, and when they don't, that triggering a response to the companies that own the technologies, the clinicians that are using them, and the bodies that are overseeing them in terms of regulation. And you know that speaks to this real-time oversight in healthcare. Really, really important that people are aware of any deviations in the AI to make sure that patient safety remains paramount. And we need to be transparent. So we'll hear in a moment from Joseph Connor, who leads an organisation called Careful AI, who are a global leader in responsible AI practices. Careful AI call for confidence ratings to be able, like a kind of like a star score that you would see when you buy something on eBay or you purchase something online, a confidence rating in terms of the AI outputs and how safe it is. Organisations like the European Union have led on areas of the EU AI Act, calling for clear labeling of all AI interventions so that people know where AI has been used, and then user awareness that in the tool that they've used, AI has been used to kind of make decisions, and also pointing the user towards making their own decisions so there's not an over-reliance in AI systems and tools. And practically for the UAE, in terms of public health initiatives, we need to think of an AI strategy development specifically for public health. We need to assess the maturity of AI tools that are out there already. We need to create governance frameworks so that there are clear policies implementing control mechanisms for AI in a responsible manner. We need to think of an implementation roadmap for new AI technologies. There needs to be a guidance on technology architecture, and in all of this change that we'll see as we move into much more of an AI world in public health, there'll need to be organizational change management to help and support people who are in the roles now that are leading in this space, and need more education and more support to be able to embed these new practices. So I'm going to try and bring this all together in a short video, so those of you who are bored of my voice can hear a different AI generated video. I mentioned earlier Careful AI, an organisation that's very much leading the responsible AI agenda globally. We're going to hear from a short video about some of the thoughts of Joseph Connor, Professor Joe Connor, who's the chairman of Careful AI, and how he has gone about responsibly and proactively calling for robust safety approaches in the space. So without further ado, I will pause and swap over to a short video. Well, which unfortunately doesn't seem to have any sound. Just bear with me 1 second, please.
Welcome to The Explainer. When it comes to making AI safe, we all tend to think the answer is more rules, more oversight. But what if that entire approach is backwards? Today, we're digging into a really fascinating take from Joseph Connor of Careful AI, who argues that our current obsession with safety might actually be making us less safe. So let's just start with the one question that frames this entire debate. It's not about trying to build a perfect AI that never makes a mistake, because let's be real, that's impossible. It's about deciding right up front what level of risk we're actually willing to live with. And this isn't some abstract thought experiment. This is the kind of stuff we're dealing with right now, using these big language models in super critical fields like healthcare. Because when something does go wrong, you're the one who has to stand in front of a coroner and explain exactly why a fatal decision was made. And this is where it gets really sticky, legally speaking. A lot of these powerful AI tools get classified as SOUP, that stands for Software of Unknown Provenance. It's just a formal way of saying it's a black box. You can't truly explain how it got its answer, and that, my friends, makes it a massive liability. So look, it all boils down to this. In any high-stakes job, if you can't explain your decision-making process, you can't defend it. You can't prove you weren't negligent. It is really that simple and that serious. Okay, so the immediate thought is, well, duh, we just need more regulation. Let's wrap these things in red tape to force them to be safe. But this is where Connor's argument takes a totally counterintuitive turn. He suggests our whole approach to regulation is the real bottleneck. And just look at this timeline. It lays out the problem perfectly. Connor says it can take anywhere from 2 to 5 years to get a medical AI tool approved. Now, think about how fast AI moves. 5 years in AI is like a century in any other field. By the time that life-saving tool gets the green light, it's already a museum piece. So why does it take so long? Well, because the whole process is manual. It's literally people reading through massive documents, trying to apply the rules, gathering huge paper trails, all to present it to a board for a check-in that might only happen once a year. It is, as Connor puts it, a huge rate-limiting step for any kind of real innovation. And this brings us to his most controversial points. He's not too popular with the folks who make a living off this process, because he basically says this slow, expensive system doesn't make AI safer. In fact, it acts as a barrier, preventing actually safe, game-changing tools from ever getting to the people who need them most. Okay, so if the old manual way is broken, what's the alternative? This is where the idea gets really, really elegant. What if we use the very technology that's causing the problem to solve the problem? And this chart just lays it out perfectly. You're shifting from slow manual audits once a year to automated systems that provide continuous proof of compliance. Imagine, instead of a guy with a clipboard, you have a real-time dashboard that shows you second by second that the system is safe and following the rules. The magic word that makes all this possible is traceability. You can think of it like a perfect, unerasable digital paper trail for every single action the AI takes. It's the ability to follow every piece of data from its origin to the final decision, which, is something software is incredibly good at. This concept is so central to everything, his team even made a little mascot for it, Tracy the bot. It's a kind of fun way to get a very serious message across to developers, which is basically, if you don't build in traceability, your fancy AI is never going to see the light of day. Now, this idea of traceable, explainable AI, it's not just about satisfying regulators. It opens the door to something way bigger. AI agents that can actually work on our behalf. And this is not a far-off sci-fi future. Connor already has a digital twin of himself, an AI that can attend meetings for him when he's double booked, using his knowledge to contribute just like he would. Wild, right? But here's the kicker. He tells this fantastic story about an AI bot he built called Strat to help with market strategy. At first, it wasn't so great, but now he admits it's actually better at his own job than he ever was. And his exact words are, it's really, really annoying. It's just this perfect, funny, and honestly profound moment that shows you where all of this is heading. So that begs the big question, right? If these AI agents are going to be better at our jobs than we are, what's left for us to do? Well, Connor boils it down to 3 deeply human skills: having the curiosity to ask why in the first place, having the critical thinking to challenge the AI's answer, and most importantly, our unique ability to learn and adapt to change. And that leaves us with one last really provocative thought to chew on. Connor is adamant that you must always, always have the absolute right to switch off the agent that represents you. It's a fundamental question of control, identity, and our place in a world that will be increasingly run by our own digital and maybe one day superior creations.
So that's wild, right? We've listened to a talk about AI, and the chief idea is that we use AI to manage AI, and we've now listened to an AI produced video on that subject. I'm not sure if we could get more meta. So I'm going to wrap up and allow a bit of time for some of the questions that I've seen coming through. So if you've got any more questions, please do post them now, because we'll have 10 minutes at the end to go through that. But what do we need in order to make this happen? So I said earlier, public healthcare across the UAE needs a collaborative vision. Academics, healthcare professionals, government officials, technology providers need to work together. Healthcare professionals need to think about what drives patient flow optimization. They need to spearhead AI literacy, whilst government officials need to think in a really forward, innovative way about how we can dynamically use the power of AI to manage AI. And technology providers need to be open to these new theories, solutions, or maybe not so new. As I said earlier, responsible AI standards have been developing over the course of the last 12 years, but technology providers need to be aware of them, and they need to buy into them in order that AI can be as safe as possible in public health scenarios. We need to build workforce skills and capacity, and that means training the workforce, transferring knowledge within the workforce from experts, and having capacity building programs ubiquitously across the region. And there are some global benchmarks and lessons that we can learn from. Like there's a framework called PRIDAR that's out there that's used by OECD and the UK. That's a comprehensive AI risk assessment management tool. There's a standards framework, one particularly called the BS 30440, which is the world's first healthcare validation framework for AI. We can look at examples of companies that have broken into the public health space, like Wysa, and have had to work with those authorities and agencies to basically come up with frameworks to give to and to develop with the government bodies, to then be able to be kind of used in a public health setting. And we can look to global reviews like the Topol Review, which basically calls for and advocates for workforce preparation for responsible AI strategies, so that people can safely deploy AI in the workforce. So in conclusion, today, we've talked about the opportunity here. There is a real huge transformational potential for public health with the advent of AI, and using these responsible AI frameworks provides such a huge and exciting opportunity in public health. We've learned around how AI can be responsibly practically implemented, what's necessary in terms of systematic governance development, maturity assessments, and ensuring strategic capacity to build on these initiatives. And I think finally, most importantly, we've touched on the global leadership opportunity that the responsible AI framework offers for the region. And so it just leaves me to say thank you so much for giving me the opportunity to talk today to all of you. It's been absolutely fantastic to pass on some of my knowledge about an area that I feel really, really passionate about. You will see a QR code on the screen, which allows you to contact me and connect directly via LinkedIn. For those of you that don't use LinkedIn, my email address is also there. So please do reach out, and thank you so much for giving me the opportunity to speak today.
Thank you. Thank you so much. Thank you very much, Mr. Ross, for that engaging and insightful presentation. So we will now move into the Q&A segment of our session shortly. To our audience, please feel free to post your questions in the Q&A box at the bottom of your Zoom screen. I will be directing them to Dr. Ross for his insights. So we encourage you to share your reflections, and let's try to think about the real-world applications of responsible AI in healthcare and public health systems. Let me start with a couple of questions to guide our discussion. So, Mr. Ross, one of the recurring concerns in AI deployment, especially in healthcare, is the question of trust. So, from your experience, how can public health systems build and maintain trust in AI-enabled services to ensure that communities perceive these new technologies as transparent, fair, and safe?
Thanks, Yasir. I think yeah, the trust agenda is a very big one. I think if we frame it in terms of what you would expect when you kind of go into your phone and maybe buy something online or engage in kind of a commercial usage of AI versus what you would expect in healthcare. I think to build trust in healthcare and AI, you need to be thinking about trustworthy brands. You need to be thinking about specific regulatory compliance tools that you would use so that people know they're in the right place, they're using something that's tried and tested, and they know that they're in the right place and they can trust the app or the website that they're using with responsible AI. So, let's face it, the public aren't likely to read governance frameworks published by public health bodies. They're not likely to delve deep into your systems, processes, regulations. But some of the things are called for in the lecture around kind of transparency models, being able to kind of have assurance that you're using AI, but how safe it is, and that being clearly displayed somewhere in the experience or the solution, so that when people go and use it, they not only know that they're using AI, but they can also see a rating scale to see how clear it is. And I think it's belts and braces, and it's a different approach to how a commercial organization would use AI and talk about their usage of AI. Because let's face it, a commercial organization don't want to spook or deter users. However, in health, we need to think about it in the opposite way. We need to think about it as ensuring people feel like they're not taking a risk, ensuring people feel like they are in the right place, and the questions they ask are validated, the responses are evidence-based, and ultimately the information they're getting back from the AI is trustworthy. So yeah, I think those are some of the things that we can do to build that trust.
Thank you so much. So, as you have mentioned, a key dimension of responsible AI is engaging the public in its design and implementation. So, how can policymakers and healthcare organizations meaningfully involve citizens and patients in shaping AI tools for public health decision making? I mean, meaningful involvement.
Yeah, I think so. We've seen this over the years as AI and digital tools per se have developed. However, we don't have a system or a framework that's out there that says very, very specifically what the steps should be. So I think there's a few companies that have done a very good job of involving patients throughout the process of the development of their software, but we need to give guidance, and we need to add that involvement as a part of the rating scale. So meaningfully engaging patients in the design and development of AI means at the point of conceiving an idea, a patient group is talked to about that idea. At the point of creating a digital tool or an AI tool to a minimum viable product, so it's not out in the market, it's developed, patients need to be involved in the design of that, consulted about it. Then they need to be testing the tool when it's in its kind of infancy. Then as the tool is further developed and goes out for general usage, then again patients need to be involved. And finally, when the tool is out in the wild and being used, guess what? They still need to be involved. And this is something that doesn't happen very often. And this is something that companies are very good at saying, we involve patients all along the the pathway. But actually, when you delve deep and you look into how much they involve patients, it's never really enough. And I think there is, from practical experience, there is a way that you can always involve patients all the way along, by just having forums, sharing information, and giving people an opportunity to feedback.
Thank you. Thank you so much, Mr. Ross, for those thoughtful and well-grounded responses. And thank you to everyone for your excellent questions. This dialogue really underscores how essential it is to place ethics and public engagement at the heart of AI integration into healthcare systems. Thank you so much, again, Mr. Ross O'Brien, for that insightful and inspiring presentation. And your discussion has really given us a deeper understanding of how responsible AI can enhance healthcare delivery and the need to maintain the ethics, equity, and human trust at these processes. Finally, before closing, I would like to send my sincere gratitude to everyone who contributed to making this event possible, including the leadership of our Institute of Public Health, the
Mr.
leadership of
Yasser,
our College of Medicine and Health Sciences,
Mr. Yasser,
and the United Arab Emirates University.
Dr. Yasser, we have two questions in the Q&A. We can extend for 5 minutes to answer them.
Okay,
Yes.
okay. Now, sorry, I missed them. Question from Dr. Afra. She's founder of Clinic AI Companion. How can responsible AI principles be systematically embedded into health innovation ecosystems to promote transparency, equity, and measurable real-world impact? So that's an excellent question.
Yeah, I would thank you for the question, Afra, and I would hope a lot of that has been kind of picked up through through the lecture today. I think the key point to focus on would be there was let me actually, if you just very quickly, I will go back to share the answer. So this slide here, there are practical steps that the UAE needs to think about in terms of how we create that transparency, equity, and measurable real-world impact. So there will need to be an AI strategy in place. There needs to be a maturity assessment, governance framework, AI implementation roadmap, looking at the technology architecture, looking at how different tools flow through the healthcare economy, but can all be systematically monitored without fail, and looking at how that organizational change management happens. So for me, it's really key that those are the kind of the steps that the UAE will need to go on in order to get to that place. And the second question, how far are we from relying on future projections, and what are the challenges that might face us in deploying those actions in governance protocols? Well, I'll tell you the good news, and that is that in the UAE there is a real appetite to do something around these principles. There was a slide earlier around IBM and responsible AI, and I talked to you about the leadership of the Chief AI Officer, Mubaraka Ibrahim. If you look at what Mubaraka is talking about at the moment, if you see her talk in the public sphere, she's very much talking about responsible AI principles, and I very much think that we will be under her leadership heading in a really positive direction, and creating principles in that way, because what we see in other regions like Europe and the US is that regulation is old in the tooth. It's been there for a long time, and people are very, very averse to changing the status quo. There's an opportunity across the UAE, across public health, to work in a way that deploys responsible AI from scratch and to do the right thing. So I think there are really good signs for this work happening at pace under the leadership of Her Excellency Mubaraka Ibrahim.
Thank you so much for the responses. Again, I would like to thank the leadership of our Institute of Public Health and the College of Medicine and Health Sciences and the leadership of UAE University in making this event possible. And to our wonderful audience, thank you for joining us and for your active participation throughout the session. Please do not forget to complete the evaluation form using the link provided in the chat to receive your CME certificate. Stay connected with us on all our social media platforms at UAEU_IPH. And don't forget to subscribe to our YouTube channel, the Institute of Public Health, CMHS, where you can watch the recording of this webinar and explore past sessions. We look forward to seeing you again in our next webinar. So until then, take care, stay safe, and goodbye. Thank you.
Thank you.
Thank you so much. It was a very engaging webinar. Thank you so much, Mr. Ross. Thank you, Mr. Yasser.
No worries at all. Thank you.
Thank you so much. Thank you.